Hello everyone, and welcome to a breastfeeding class presented by the Breastfeeding Clinic in the Helderberg Basin in Cape Town, South Africa. Just a quick disclaimer, the information provided in this program is to assist you in exploring all available options to help empower you to make well-informed decisions, to help you feel in control, be responsible for, and have confidence in your choices. Information should please not be substituted for the diagnosis and treatment of any medical condition. And also please never disregard professional medical advice or delay in seeking it because of something that you have received in this program. And this recording is not intended to replace professional medical or other kinds of advice. Now in this recording we will be looking at early management goals and how to cope if things don't go as planned. And I have highlighted it for you on the list of topics we are covering in this breastfeeding class series. Now, remember from an earlier session, the postpartum early management goals that enable exclusive breastfeeding for a normal, healthy baby could be seen as A, B, and C. A is for attachment, literally for comfortable and effective latch and milk transfer, and figuratively for a consistent and reliable positive relationship. B is for breast milk production, so there is enough milk, and C is maybe getting the calories that they need to grow as expected. Now, this is the easy scenario that we can expect if the mother is healthy and motivated and educated, and the baby is healthy and born at term, and the hospital staff is trained in lactation support. So sometimes babies are getting enough milk, but their mothers think that they are not, and sometimes babies are really not getting enough milk. So in all cases, it's important to determine whether the baby is getting enough milk or not, because a chronically underfed baby who is not gaining weight becomes a weak, ineffective feeder who may lose their appetite and feed sleepily. And this leads to an inadequate milk transfer and then a compromised milk production. And these babies need assistance to gradually take more milk and begin regaining their birth weight or regaining their weight. And some babies just need time and calories before they feed effectively. And again, I've said this before in another recording, but any issues, whether it is with the breast like engorgement or mastitis, or with the nipple like nipple pain or cracks, or with the mother's milk supply, or the baby's weight gain, or the baby's behavior, the first thing that we need to do is look at the positioning and latch, because more often than not that is the cause of the problem. Okay, so what can we do to help a baby who is not getting enough milk or not gaining as expected? So when there are issues, reprioritize the ABC goals. And just reframing the ABC to CBA creates a more realistic and safe and unpressured plan to enable exclusive breastfeeding. So the weight gain management goals for a healthy baby who is not gaining as expected include improving the baby's intake, so that's C, calories, increasing the mother's milk production, B, breast milk, and improving milk transfer and protecting breastfeeding. So give any supplements in a way that does not interfere with breastfeeding. That's A, attachment. So just let's have a quick look at each of these. So C, or calories, is rule number one. Always, rule number one is feed the baby according to the baby's needs. So on day one, if the baby is for whatever reason unable to breastfeed or feed at all, or feed but feed ineffectively, follow breastfeeding efforts with spoon-fed colostrum on an individualized monitored plan. So somebody needs to be looking after them, and hopefully it will be the baby's doctor. So any late preterm or early term babies may need to be supplemented with express breast milk until they are able to consistently demonstrate all elements of effective feeding. So what are elements of effective feeding? The baby is feeding comfortably. Another element is the baby takes slow, deep sucks. Sometimes they're pausing for a short time, but you can see and hear the baby swallowing. The baby's cheeks are also full and not drawn in during a feed, and the baby finishes the feed and releases the breast by themselves and then look content. So these are the elements of effective feeding. Anyway, so preterm babies, late preterm or early term babies, they may need to be supplemented until they are able to consistently demonstrate all elements of effective feeding, until they have expected elimination patterns, so they are pooing as expected, and they've stopped losing weight and started to gain weight. So if a newborn is able to feed, just let the baby suckle for as often and as long as they want, because this will also help stimulate the breast and milk production. Okay, so how do we know a baby is getting enough milk? If you remember this from a previous recording, we know a baby is getting enough milk if they are gaining weight as expected, if the feeding is comfortable and the excess is excreted in a nappy. So, is the baby's weight within the expected range? There are some things to consider, like how often and how long is the baby feeding? How does the baby finish the feed, or are you stopping the baby after a set time? What is the baby's output like? How many poo nappies does the baby have in a 24-hour period? Are there any other risk factors for lactation problems? So the very first thing that to do is, if the baby is not gaining as expected, is again have baby's position, latch, and suckling assessed by someone trained in breastfeeding support. Because by now you know positioning influences the way the baby latches, which influences the way the baby suckles, which influences the effectiveness and comfort of milk transfer. So how much milk the baby gets with what degree of effort. Now, an ineffective latch results in pain sometimes, nipple damage sometimes, but ineffective milk transfer always. And this leads to reduced milk production because the baby is not removing the milk. The feedback inhibitor of lactation signals the breast to make less. And then the baby develops ineffective sucking habits to try and compensate, maybe for the latch. And this might lead to early weaning, and then you're not reaching your breastfeeding goals. So sometimes a position change can help a baby get a deeper latch and take milk out more effectively, but sometimes extra calories may be needed to support weight gain. If supplements are needed, the order of supplementation is first breastfeeding, meaning how can we help the baby increase intake at the breast? And if that doesn't do the trick, the next on the list of supplementation is the mother's own expressed breast milk, then donor milk, and last resort is artificial baby milk. And we'll talk more about supplementation in a bit. Okay, so to increase intake at the breast in a sleepy baby, the mother may need to lead the feeds for a day or two and wake the baby for feeds if the baby is very sleepy due to trying to conserve energy, and wake the baby up if the baby is sleeping for too long, because how can you fit in 8 feeds in 24 hours if the baby is sleeping for long periods or regularly sleeping for long periods, which many calorie deprived babies who fail to gain weight do. So whether the baby is underfed due to physical or management or maternal issues, they are likely to conserve their energy by suppressing movements and sleeping more, and their muscle tone may seem low at first, but when the feeding problem is addressed, they begin to gain weight and the energy and activity improves noticeably. Okay, so it will also help if the baby suckle more often, maybe 8 or 10 times in 24 hours, more if the baby is willing. So offer the breast every 2 hours, let the baby suckle whenever they seem interested, and let the baby suckle for longer than they did before at each breast. And stop giving water and other liquids and formulas and dummies. Try and satisfy all sucking needs at the breast. And keep the baby with you and breastfeed at night. And it may help to drain the first breast before offering the second, and also do some breast compressions. Now, breast compressions keeps milk flowing and it helps the baby get more milk, and it also helps them to drink more actively. So do compressions for a baby who's not drinking actively, or for a baby who wants more, or for a baby who seems to fuss and pull off the breast when the lay down starts to slow, or for a baby who seems to fall asleep after a few minutes of active suckling, when there was ample milk and now the milk also slows. So how to do breast compressions? Support the baby with one arm, maybe the cross cradle hold. Cup the breast with the other hand, the thumb on one side and the fingers on the other side, close to the chest wall. And then begin breast compressions when the baby is not drinking much, before the baby gets too sleepy. So compress the breast when the baby sucks but doesn't drink. And just squeeze and hold, but don't hurt yourself. And the baby should start drinking stronger, more and more actively. And then release the pressure if the baby stops sucking, or if the baby suckles without drinking, just to allow milk to start flowing into the compressed areas, and then compress again. Okay, so we've tried to increase baby's intake at the breast, but after a few days of feeding more and doing breast compressions, and we had baby's positioning and latch checked, the baby is still not gaining. Now we have to make sure that the baby is fed adequately, because rule number one is feed the baby. So, because sometimes to make sure that the baby is fed adequately may require supplementation. And ideally, this is with my mother's expressed breast milk. So please work with your baby's primary care provider or an IBCLC to help you during this time. The primary care provider or the lactation specialist will suggest supplementation depending on the baby's weight issues. Now, I'm going to tell you about the amounts now, but please, if there are any issues, talk with your baby's primary care provider. Now, we only really have clinical experience and expert opinion when it comes to the appropriate amount of supplementation. Now, for a healthy term newborn, based on limited research available, the suggested intake should actually reflect normal amounts of colostrum available, the size of the baby's tummy, the baby's age in days, the size of the baby, and this intake increases over the first few days based on the baby's demand. Now, the amount shown in the slide is the average intake in milliliters per feed for a healthy newborn baby. Now, if supplementation are needed in the early days, this could be used as a guide. But keep in mind, again, please, family's primary care provider will determine the amount of supplementation when it's needed. So during the first 24 hours, the volume of supplementation or top-up is anything from 2 to 10 moles per feed. During the second 24 hours, 24 to 48 hours, the volume may be between 5 and 15 moles per feed. And then day 3 and 4 post-birth, the supplementation could be anything between 30 and 60 moles per feed. And if the top-up volumes are still needed after day 6, we usually use the birth weight and work out the volume top-ups on that. But again, please check with your baby's primary care provider about the amounts for a baby who needs supplementation if they're not feeding at the breast. And then supplementation in the later days. This information on the slide is from the South African Infant Young Child Feeding Policy. The supplementation from week 1 to 6 depends on the situation. For example, if it's a healthy baby just maintaining weight or losing weight, one might start with 30 to 60 ml top-ups per feed. I know many underfed babies cannot take much more. And then as the baby gets more calories, the baby will have more energy and the baby's appetite will increase or improve. And then the amount needed to regain birth weight and grow appropriately will vary depending on the baby's sex and the baby's metabolic needs, etc. Most babies only need additional milk for a few days. And again, please check with your baby's primary care provider about the amounts for a baby who is in need of supplementation. And then once interventions are initiated, the weight could be rechecked after 2 to 4 days to confirm that the trend has reversed. And weight gain should be at least around 30 grams per day for the first 3 months. So babies who are ingesting the prescribed amount, but they are still not gaining, they need to be evaluated by a medical care provider for possible illness or neurological problems or something like that. Okay, so what do you think are some of the signs of improvement? So, obviously, weight gain, um, also increased alertness in the baby, less crying, stronger sucking, more wee and poo nappies, changes in your breast, such as fullness, maybe leaking. Um, and if the baby's weight gain was very low and supplements were needed, supplements will be reduced gradually as the situation improves. And this can be done in concert with the baby's primary care provider or your IBCLC. But please note if the baby appears lethargic or feeding very poorly, or if the baby has a weak cry or dry mucous membranes, the mouth feels dry, or it seems like the baby has a difficulty breathing, or the baby is very sleepy, or has poor muscle tone, or poor skin elasticity, or the urine is concentrated, or there are infrequent bowel movements, or no poo nappies, please take your baby to your primary care provider ASAP. Okay, so we have made sure that the baby is fed. Now we need to make sure that the milk supply is protected. So if for whatever reason a baby is not feeding effectively, in addition to breastfeeding, increased stimulation of the breast to build and protect the milk supply might be needed. And the easiest way to do this is to take more milk out because the demand equals supply. So again, if the baby is not gaining as expected, see someone trained in breastfeeding support to have baby's position and latch and feed assessed. And this person can also screen for breastfeeding management problems as well as assess for possible psychological or physical factors which might be the cause of low milk supply. And we'll look at this in a separate recording as well. And we'll also look at how to increase milk production in a separate recording. Anyway, easy things that can help protect and build a mother's milk supply are to let the baby suckle more, maybe 8 to 10 times in 24 hours, more if the baby's willing. Just offer the breast every 2 hours, let the baby suckle whenever they seem interested, let the baby suckle for longer than before, and stop giving water and other formulas and dummies. Let all sucking needs be satisfied at the breast. And keep the baby with you at night. Train the first breast before offering the second. Do some breast compressions. Will help the baby feed more effectively and also help train the breast more effectively. And as mentioned, we can also look at causes of low milk supply and increased milk production in separate recordings. Now, a mother can also hand express or use a breast pump a few minutes after each feed as a way to add more demand to the breast. And this will also provide her with the milk that she needs to top her baby up with. And as the supply increases, the baby is feeding more effectively, and the baby will be taking what he needs from the breast, and the top ups can start to decrease. So the problem with giving artificial baby milk as a top-up is that then the mother also needs to build her milk supply in order to provide the baby with all they need at the breast once they're ready to take everything from the breast. And then lastly, we've made sure the baby is fed more, we've increased the mother's milk supply. Now we have to look at attachment. So attachment is about ensuring an effective latch and milk transfer, literally and figuratively protecting breastfeeding. So to protect breastfeeding and eventually effective latch and milk transfer, do lots of skin to skin. And please see the recording on the impact of birth practices, focusing on skin to skin contact for more information on the how to and the benefits. Now, the process of attachment may be very gradual and be most dependent on a robust milk supply. So for the baby who's struggling at first, anticipate greater ease with feeding when the flow rate of milk is higher. And then close follow-up is essential for a baby who had a slow start. And again, have the feed assessed for effective and comfortable positioning attachment and suckling. So please watch the recordings on position of the mother, position of the baby, baby's attachment, baby's suckling, and I will post the links to those video or recordings in the description below. Okay, so when or if supplementation is needed, we need to offer it in a way that does not interfere with the breastfeeding relationship. So there are many options like feeding a baby with a cup or a teaspoon, or finger feeding or syringe feeding, even offering supplements at the breast for a baby who is able to suckle. Now, if bottle feeding is chosen as a method of top-up, please chat to an IBCLC on how to go about doing this with paced bottle feeding. What type of teats and what type of bottles and what is finishing at the breast method of supplementation, etc. Now, this is what the steps in the breastfeeding process can look like when a baby has what we call a disorganized suck, because due to so many reasons. But you can see how the baby progress. So first and foremost, the first step is skin-to-skin contact. If the baby is not yet breastfeeding, the mother is maybe expressing to help establish a milk production, and the baby is probably fed with an alternative method. So for the non-latching baby, whether the baby is prem or full term, just give the baby time and calories. And ideally, these calories is the mother's own milk. So while skin to skin, the baby's mouth or nose is against the nipple. The baby will smell the nipple and smell the milk. And next, the baby will show some rooting and feeding cues, maybe not yet eagerly. And an awake and alert baby will start rooting with a wide open mouth and turning their head from side to side. And then they will grasp the areola and latch, tasting the milk, but they might come off again. And the next step is they might lick the milk from the breast and swallow it without sucking. And before you know it, the baby will be maintaining a latch. And the baby might give short suckling bursts and swallows, but they may tire easily. But then the baby will progress to longer sucking bursts and they will enjoy a breast meal. And baby will then start to show more effective, frequent sucking and audible swallowing and that visible movement of the jaw. And then during this process, supplementations are decreased gradually while you're keeping an eye on the baby's weight, and voila! The baby and the mother are enjoying full breastfeeding. Yay! Okay, so thank you so much for watching this recording. In the next recording, we will look at hand expressing. Please visit the Breastfeeding Clinic at www.breastfeedingsa.co.za if you would like to book a private consultation and receive the class notes. And you can also navigate the class recordings easier from the website. And please feel free to subscribe to this channel for more breastfeeding class recordings, and take care till next time.